That's just my personal. So I'm assuming Leo is calling in. Is Leo on the line yet? All right. Well, we'll see how that works. I texted him last night and sent him all the info via text, so he should have it twice. How's Betsy?
Good, how you doing?
Okay, it's so hard to see you with your mask on.
It's all right, I'm okay with it. I'm okay with the less you see.
You know, there was a time that I really wanted to be masked. And when COVID first started, I was wearing masks and crazy glasses and a hoodie. Liddy was like, oh, Dad, you always wanted to dress like this. And I was like, I did, but I didn't want this to make it happen.
Okay.
Test.
You know, Gail isn't going to be able to make it today. You know that.
Yeah.
Yep. So Sid, what do you need me on this meeting for?
You know,
I said,
sorry, go ahead.
Hi, Leo.
Oh, Leo's here, great. What do we need Charlie for?
don't need him at all, I don't think.
You know,
I'm not on the agenda for anything, and I was like, okay, you want me here? I'm here, but I don't know why.
well, then we should cut you loose because you're really busy and I don't want to waste any of your time. I apologize for that. I think maybe I had in my mind thought, you know, the list of people without really looking at the agenda, and you're most always on that list. So that's okay. Anything you want to give us an update on before we cut you loose?
Well, Sid, you wanted me to throw that old lady out of the house Sunday morning, so I gave her a toss, and she's out. And now I have family and friends fixing everything for her.
Yeah.
And the hospital said they're going to release her today so she can go back. And Saturday and Sunday, they're going to finish fixing the house up. And then Tuesday, I'll take a look. And if I'm not happy, I'll throw her back out on the street.
Lovely.
Is there anyone else you want me to take care of while I'm in town?
No, I think I'll just give you an update quickly while you're here. I don't know if you've driven by the barn on the end of Flag Hill. It's not officially on our agenda, so it's not really an item, but it looks like it's either collapsing more or they're moving forward with taking some stuff down. So I would say progress is happening from my perspective, one way or the other.
All right. The rest of the stuff you know about, it's in the emails. But like I said, if you got somebody else you're ticked off with, just give me a call.
All right, you're our enforcer, I know. Thank you, Charlie. I appreciate your energy.
See you, Leo.
See you later, Charlie. Have a good day.
Bye.
Hey, Leo, how's it going?
Good, you?
I'm okay. So who else is on the call? We have Leo, me, we have Betsy.
Lisa White.
Oh, Lisa White's here, awesome. And is that it?
Yes, as far as I can tell.
All right, so we don't have a lot, because some of the stuff that we're gonna talk about, either Lisa can update us, or we are not gonna have much of an update. So the first thing, but I guess I should call the meeting to order at 3:04.
So moved.
Thank you. First thing on the agenda is the health nurses update. And so Lisa, the floor is yours.
Thank you, Sid. So let me start with COVID cases in town. I have not personally been working on cases. Melanie Zamoyski has been covering Irving's cases of late, but I did run a report just before the meeting to see what had been your activity. And in the last month, there have been only 2 cases in Irving. One was a high school student. One is an adult living at home with no contacts. The high school student had only household contacts of concern. and had a known exposure to a friend. So rather quiet there. I can say Cooperative Public Health Service wide, we've had about 50 cases over the last month. And it's a slowing of the surges that we had after Christmas and New Year's. But there are still cases happening and still illness circulating. So that's about all I have on case follow-up. But if any concerns or questions before I move on to other.
Oh, doing a good job.
You are. We're so glad that, this is happening. I know you hear that a lot when you come to our meetings, but we just want you to know that, we appreciate what you do, and I'm sure other people do, and if they don't say it, we're saying it for them.
That's really kind of you. Thank you. Well, now I'll report on COVID vaccine clinics.
Cool.
We've been busy with them, not to the extent that we will eventually, as DPH is going to ramp up eventually our access to vaccines, and vaccines have been severely limited. I know that for residents trying to sign up, this has been an especially trying time. The PrepMod system is difficult to work with. There are not slots available as people are looking for them. We have worked over the last week to plan and execute a couple of clinics, 2 in Bernardston on Monday and Tuesday that went well. We had 250 vaccines to give at each of them. And then we're planning for Friday a limited vaccine clinic in Montague that we've been working with the Irving Senior Center. Paula and Becky have been great at getting people signed up. But again, doses severely limited. We had asked for 1,400 doses this week, and we got 500 to split between Montague and the town of Orange. So we're going to Montague with 290 doses and all full slots on Friday morning. We'll run through the afternoon at Turners Falls High School. Things are running smoothly within the clinics themselves. We're able to maintain social distancing, get people their needed vaccine. The volunteers that we have providing vaccines and helping people get signed in and get their sign in for their second dose have been awesome, and things have run very smoothly. It's also been a great help to have police and EMS presence at each of those clinics. And the team that we have working together to organize the whole thing. I mean, it's there, it's difficult with PrepMod and just the logistics of vaccine during COVID time. But I would say that increasingly, as we've held these clinics, and we're, I think, at about 2,000 doses out so far, with clinics in Deerfield, at Mohawk Regional, Bernardston, and now moving to Montague, that things have gone better and better at each clinic. So we hope to continue. I know that the oversight team is going to be asking for town input on how we proceed in the future, but our goal is to have for the full region, and this is with DPH's confirmation of a plan, that we would get 750 doses 5 days a week to serve the region in the collaboration that we're engaged in through the Council of Governments, the City of Greenfield, and Orange. I'll stop there.
That's great. So what's did they propose a timeline for all that to roll out, and, for them to basically either accomplish at least the first step of the goal or accomplish the goal that, is set out? Is there like a timeline?
Yeah, they went, and we get this from Jana Ferguson, the Assistant Deputy Director. The current plan is that next week, it would be 2,100 doses for the full region, and that would happen for 2 weeks. And then we would ramp up yet again, and I'm sorry I don't have that number off the top of my head, but getting yet more doses for the region after the next 2 weeks. And then we'll be engaged also in giving second dose clinics. So we feel like it's manageable. It'll be a big push, but we want to get to that 750 per day, 5 days a week. And we think we can do it.
Sounds great.
All right. All right, Lisa, thank you so much. Again, I appreciate what you do, and I know the job is immense, so I don't know what else to say.
Doing a great job.
Thanks so much, guys. I'm gonna hop off if that's okay.
Okay,
Yeah,
have a good
we
weekend.
have one more item. We're going to skip over 2 items and move on. So thank you very much again.
Thank you again. Bye-bye.
Bye. Hey, so we had item number 3 was update from the elementary school nurse. She's not here. Item number 4 was emergency management update, which was going to be Phil's probably busy. Originally, we were kind of in hold because we thought there was going to be no vaccine. That's why the next item will come up. And so I'll give you an update after. I'll just let you know that we thought there was no vaccine. I'll leave that hanging. Item number 5, which will be to basically rescind this vote that I asked for last time to create the subcommittee. I don't want it to be a subcommittee anymore. Too many bells and whistles attached to that. Let's be a working group. So let's first I'm going to put the motion on the floor to dissolve the subcommittee. Can I get a second?
So moved.
Thank you, sir. So what we'll do is, I don't think I need a motion to create the working group, but
Yeah, I don't think so. No.
Okay, so we're basically what's going to happen, Leo. There was a lot of stuff involved. You probably already knew this, where we need to have people appointed, and Betsy wised me up to this, and have them come in and swear, and it's a big pain in the neck. What we had done is, did it as a working group. That format worked fine for me. I wasn't really comfortable with it because I didn't know what it was until I kind of understood it. So I'm more comfortable with a controlled format just because I know what I'm up for. So the working group thing works. It just gives us a way to hear from the nurse and hear from emergency management, Phil, and that kind of stuff. And so Phil had let us know that we were kind of in a hold because no one was really expecting vaccine. A bunch of things happened, and there was the snowstorm, a bunch of stuff like that. And then everything changed. I'm going to say 10 days ago, Betsy. Was it about 10 days ago, 7 to 10 days ago, that you're like, oh, no, we have a vaccine. So the scheduled other meeting of that working group was if they had time to pop into this group, and clearly they didn't, and that just tells me that they're working. And so, and they know that I understand that. So they're working probably, and they're probably getting this all set up, and I'll hear whatever their report is at the working group. And if they're here to tell us themselves at the next actual monthly meeting, great. And if not, I'll just give us a whole report of what happens over the next 3 weeks, because I think we're just going to have those random meetings every week still at the same time, 3 o'clock, but it'll just be a working group, and whoever can show up depending on their availability and what's happening. Cool?
Cool. Sounds good.
All right. So I think we're done. Motion to adjourn the meeting?
So moved.
Excellent. All those in favor?
Aye.
Thanks, Leo. I appreciate it. That was an easy login. That was fast. I like it.
All right.
We're all getting better at this. I had to actually yell at an instructor the other day from the other end who was, on Zoom, you're allowed to hit a button that allows people on the other end to record the call, right? And it's called giving permission to record, right? And so we're all in this class and we're asking the instructor, sir, can you please give us permission? And the guy just kept saying, I give you permission. And we were like, no, verbally is not how you do it. You have to click the button. And he's like, I said, you can have my permission. So this went around and around, and then everyone in class gave up because we were like, all right, I'm teaching the class has no idea what we're talking about. So I love technology. All right, on that note, Betsy, you're the best. We appreciate all you do.
Thank you.
Okay,
You guys
good.
have a great day.
Enjoy the
All
beautiful
right,
weather. Great. Yep.
yeah, you wish.
Bye-bye.
Bye now.